If you're a doctor looking for your first job or changing jobs, here's some advice from a senior medical director who interviews candidates all the time for an organization. The medical community is not a large one, especially if you're staying within one city and changing jobs. It is a small community, and most of the doctors know each other, especially within your own field. So I've got to interview this person in a few weeks, and I'm doing my due diligence and research. And it did not take very long for me to get all the tea, as the kids like to say these days, on this person. I'm not going to go into details, but here's what I'm going to tell you. Wherever you're working, please treat your other colleagues with respect, be a great team player, get along well with your physician colleagues. Of course, take good care of your nurses, your staff, treat everybody with dignity and respect, not just your patients, that goes obviously without saying, but all the people that you work with. Be a good team player, be a decent person, because if you're not, like I said, the community is really small and we find out things pretty quick. Now, I know some of you may be thinking, well, you should go into sort of this interview with an empty slate, give the person the benefit of the doubt, kind of make a clear sort of judgment based on your personal interaction and the CV, which I agree the merits to that. But keep in mind that recruiting a physician, whether it's to your practice as a partner or organization, is a massive, huge investment of time as well as money. So it makes sense that folks in my position, we do our due diligence and of course review the CV, review the LinkedIn, and talk to other people that have worked with this person. And team-based care is really important. I can't emphasize that enough. We want people that work well together in a team. If there are signs that you cannot get along with your colleagues, your physicians, and other specialties, that's a real big red flag. So if you want the job of your dreams and you're really looking to make a change, even if your current situation is not great, how you handle that, how you carry yourself, how you sort of work with your colleagues, even in sort of suboptimal situations, is really critical.